Visas and health cover. What do I need? When you apply for your visa, you usually be required to go through health examinations to meet your visa's health requirements. These include medical examinations, X-rays, tuberculosis screening, and some other conditions if you are coming from a high-risk country. These health examinations can be done offshore, in your home country, in authorized clinics. Contact your immigration office near to you and they will give you a list of providers. Or, if you are in Australia already, then there's a list of Bupa clinics that can perform this medical check. You can easily book your appointment online on the following website. Depending on what visa you have, you can enjoy different health fund benefits. Let's go through some of the essential information you need to be aware of by visa types. The costs also vary depending on what visa you have. Student visa. Overall, most of the students are not eligible for the government-funded system, Medicare. When you are coming on a student visa, you will need overseas student health cover insurance unless you are exempt and you arrive from those countries as listed earlier. The best advice is to check the government website for your visa health requirements. Where can you buy your student health insurance? Not every provider has a student option, so the choice is not as big as for other visas. Some of the big providers you can compare are Medibank, Bupa, AHM, Alliance, NIB. The basic cover for a student can start from about $580 per year for a single person. This price is for basic hospital cover, and it does not include any dental, optical, psychology, or chiropractor services. You can take extras cover for additional charges if you want to include these in your health cover. Most people on a student visa are generally very healthy, and they usually opt for the mandatory hospital cover only. Work or sponsorship visa. You or your employer need to arrange your health cover. It is mandatory. The reason why the government requires that you are insured is that healthcare costs are very high if you need to pay for all the services just yourself. Ambulance, hospitals, public or private, GP and specialists. The health insurance companies have specific products for non-citizens. Covers can start from approximately $800 per year per person. You have the options here to take hospital cover only, or add extras for dental and other specialist services. Many young and healthy people take only the mandatory cover and forget about extras. This saves them several hundreds of dollars every year. There are more choices here compared to students. The next website gives you a list of various private providers. Compare their covers and the benefits before you pay for your health insurance. Useful tip: if you are on a work sponsorship visa, you can negotiate health benefits, and whether your employer or you pay for the mandatory private health insurance. Full insurance, hospital, and extras for a couple can cost over $5,000 per year, and if you can include this in your compensation package, you can save a lot. PR visa. Those who are on a PR visa are enrolled in Medicare. Okay, so you are covered. Yes, but you can still have out-of-pocket expenses if you want to be treated in a private hospital, want routine procedures faster, or if you need specialist services. So Medicare is a free or low-cost public health service. Do you need private health insurance at all? It's a good question. Not everyone has private health insurance in Australia. Currently, about 50% of the population has this. If you need urgent treatment, or if you have life-threatening injuries or illnesses, you will be treated very well in a public hospital. You do not need any private health insurance for this. But the government strongly encourages people to take out private health insurance, and if you don't, then you need to pay a special tax called Medicare Levy Surcharge. There are various rules who must pay this. One example is if you are earning more than $93,000 per year, you will have an extra tax of 1% if you do not have private health insurance. Depending on how much you earn, this can go up to 1.5%. So, this extra tax you pay is $930 per year on the $93K income. How much does a basic hospital cover cost? There are plenty of authorized insurers who offer private health insurance. You can quickly get a quote from comparison sites or from the health insurance. Usually, a basic cover would cost you about $1,100. The difference between the tax and the basic cover is $170. So you may get the cover and pay the extra $170, and you at least have the option to go to a private hospital and be treated faster with your doctor of choice. You can learn more about the surcharges and the income threshold at various government sites.